healthcare system is broken, but it doesn't have to be. This is Revenue Cycle Optimized by Infinix Healthcare. We discuss the latest challenges in the revenue cycle space and provide actionable tips on how to overcome them at your organization.
Welcome everyone to another episode. I'm Stuart Newsome, your host for today's session, titled Help Wanted, Tackling Healthcare Staffing with AI and Automation. So we're here to actually discuss one of the most pressing issues in healthcare today, which is staffing shortages. Everyone's experiencing it and it's been going on for a very long time now since COVID. But what we're also going to talk about is how AI and automation can help alleviate these challenges. So today we'll cover factors like the impact on staffing shortages of healthcare. We're going to explore those AI-driven automation solutions. And we're also going to discuss some of the practical steps for implementation. So without further ado, let's dive right in. So really to start, I just wanted to look at the current state of healthcare staffing. So according to the Association of American Medical Colleges, the U.S. faces a projected shortage of between 37,800 and about 124,000 physicians by the end of 2034. Now, I know what everyone's thinking, 2034 is such a long way away. It's only 10 years. So when you stop and think about it, wow, that's only 10 years. Just think what you were doing back in 2014. And you were thinking, oh, wow, 2024, that's such a long way out. Before you know it, it's here. We're in 2024. Same will happen for 2034. So this is something that has a huge impact on us that we need to consider right now regarding physician shortages. But this shortage is not just limited to doctors. It also affects nurses and other healthcare professionals. They're all on short supply. Certainly, the COVID pandemic has exacerbated these issues. That led to a lot of burnout and significant numbers of healthcare workers that were leaving the field. That's been well documented. It's really been documented more in line with physicians and clinical staff, but it also affected the business side of the fence with revenue cycle personnel, patient access personnel. And though COVID was just a few years ago, the after effects of the Great Resignation are really still felt very hard. Staffing shortages have a direct impact on operational costs as well as patient care. So, for instance, healthcare providers are focused to spend more on overtime, or they're actually forced, I should say, to spend more on overtime. They also have to hire temporary staff and recruit some recruitment efforts to help fill those gaps. So in 2020 alone, the American Hospital Association estimated that hospitals spend an additional $24 billion annually due to nurse turnover alone. Two things to notice about that statement. Yes, that's billion with a B, 24 billion annually that has been spent due to the nurse turnover alone, not physician turnover, not RCM staff turnover, not patient access turnover. That's just nurse turnover alone. Can you imagine the number if you add in all other healthcare professionals that are affected by this? So this financial strain affects growth as well as profitability. It's making it very hard for healthcare organizations to maintain their operations. So these challenges are felt across the board, from front office staff responsible for patient scheduling to back office staff managing accounts receivable, particularly patient access leaders and revenue cycle leaders. They are experiencing significant staffing challenges today. This has resulted in longer wait times for patients and increased workload for existing staff, leading to the decreased job satisfaction and higher turnover rates. So now let's discuss the financial implications of these staffing shortages. So healthcare organizations are competing to attract and retain staff, often offering salaries and bonuses above the market median. This competitive environment drives up operational costs and further straining the financial health of these organizations. So if you just think about that for a second, when you're attracting the staff, you have to try and retain the staff and keep the staff you have. Those salary increases and bonus increases, if they go above that market median, then it shifts the market median. And it just kind of becomes a perpetual cycle where if you're going to keep staff happy and keep them and make it an attractive, because they're really not going to come back on their own, then it's just going to keep moving that needle, so to speak. So it's a big issue and challenge where the healthcare organizations, they are just inundated with other financial implications, other financial struggles, apart from the staffing struggles that they're having right now. Now, the pandemic also led to a significant shift in the job market. So what I was alluding to earlier really speaks to that many healthcare workers have left the industry or they've actually reskilled for other roles. A talent gap that needs to be filled, but it's very difficult to fill. For example, a survey by MGMA found that 73% of healthcare leaders identified staffing as the biggest challenge in 2022. I know that was 2 years ago, but I would imagine that number hasn't changed very much. This shortage is particularly acute in the front office, where tasks like patient scheduling and insurance verification are critical to maintaining a smooth operation. Now, for everyone in patient access, I feel your pain because you're dealing with the public. You're dealing with patients, and these are human beings. When I say the public, that's what I mean. And to be honest, we humans can be crazy sometimes based on circumstances. And dealing with the public can add a lot of stress. Also, when you add the stress that you need to make sure that patient's financial responsibility is taken care of, so you have a fiduciary responsibility. You also have a fiduciary responsibility. Insurance is correct and everything aligns, getting the prior authorization done in a timely manner so it doesn't go out of the bounds of the timeliness of having that procedure done before that prior auth expires. There's so many factors that add to the stress. It's no wonder that the turnover rate for patient access can be anywhere from 6 months to a year. So imagine changing your staff or certain parts of your staff, even if it's a majority or minority of that staff, it's still going to have an impact. So staffing shortages also impact the quality of patient care. Obviously, what I just described is a good example as well, but delays in scheduling and longer wait times can lead to poor patient experiences and decreased satisfactions. So patients who face difficulty in accessing care may seek alternative providers, further impacting revenue, but it also affects the reputation of that health organization or that provider or even the staff. What is that reputation? So essentially, implications of staffing shortages are very far reaching. I think that goes without saying. With fewer staff, healthcare providers may struggle to maintain their revenue cycle processes, which leading to delayed billing, increased denials, lost revenue. We all know that story. We've been there, done that before. And we spoke about that ad nauseum, it seems like, on these episodes. But if many of you will recall, the initial reaction to the pandemic was to furlough employees and reduce staffing levels. Now, this all made a lot of sense at the time because elective surgeries were now no longer were put on hold because of the pandemic. Certain office visits were put on hold because of the pandemic. So likely there was a lot of revenue, a lot of CPTs, a lot of surgeries, a lot of services that just were not being performed. So you didn't need the staff to do the billing for them. So doing that furlough and reducing those staff levels made sense. But then what happened? This really proves to not be sustainable because the patient demand rebounded and it rebounded in a fury, right? So providers had to scramble to rehire the staff and manage increased workloads, further straining their financial resources. Now, to illustrate the financial impact, consider this. The cost of recruiting and training new staff can be very substantial. According to a report by the Society of Human Resource Management, the average cost per hire is approximately $4,129, give or take a penny or two. And the time to fill a position averages about 42 days. So that's a lot of time and energy and efforts considered by not just one person. It's typically an HR staff, some C-level staff that have to make decisions, some management staff that has to make decisions. So this does not account for the lost productivity and potential revenue loss during the recruitment and training period. So additionally, high turnover rates can lead to increased costs for temporary staffing solutions and overtime for existing employees. So someone's got to do the work. And the only way to do that is to fill in those gaps with what you have. You have to go to battle with the army you have, not the army that you wish you had. So again, that can cost a lot of revenue. So given these challenges, what can healthcare providers do? Well, one promising solution is AI-driven automation. And AI and automation can play such a crucial role in transferring revenue cycle processes. They can also improve efficiency as well as reduce operational costs. I think everyone has probably heard those points in many other AI presentations. You certainly have heard it here in this platform. But let's explore some of the ways that AI and automation can help with staffing issues and be applied in healthcare regarding staffing. So first, AI can be used to predict staffing needs by analyzing historical data and identifying certain patterns. Now, this allows healthcare organizations to better plan for peak times and allocate resources. AI-driven predictive analytics by the use of machine learning can help forecast patient volume. It enables providers to schedule staff more efficiently and also avoids any overstaffing or understaffing during those critical periods. Now, additionally, AI can automate administrative tasks such as patient scheduling, insurance verification, prior authorizations. By reducing the manual workload on staff, AI frees them up to focus on higher value activities in patient care. Again, for example, automation can handle the repetitive task of checking insurance eligibility, as well as benefits, which often involves navigating multiple payer portals, getting on the phone, entering data manually. This reduces the burden on staff and ensures the patients receive the information they need promptly. So by automating this process, healthcare providers can ensure accuracy as well as speed. This reduces the time patients spend waiting for their appointments for all patient satisfaction. And that's what we all are aiming for, right? It's more than just revenue. Now, according to a study of HIMSS organizations, they implemented that really have implemented AI. The prior authorizations saw a 60% reduction in time required to complete the process while maintaining the same staff level. So now imagine that you get 60% of your time back. What would you do with 60% of the time that is said here? Here's some bonus time for you. What could you do with that? What could your staff do with that? Just imagine how it can be replicated, and the implementation of AI can actually free up more time for you. Similarly, automation can assist with AR management by using AI to analyze claims and prioritize what follow-ups need to be done. Healthcare providers can focus their efforts on the claims most likely to be paid. This target approach can significantly improve revenue recovery and reduce the workload on staff. For instance, AI can help identify patterns and denials and suggest the most effective follow-up actions. This ensures that staff efforts are focused on the high-impact activities. The benefits of implementing AI and automation are extremely significant. Not only can these technologies improve efficiencies and reduce cost, but they can also enhance job satisfaction by taking over mundane tasks and allowing staff to focus on more meaningful work. And job satisfaction is so important. There are certain analogies that speak to that, but I can tell you right now that most people who go to work, they want to go to work and let it be meaningful work, that it had a purpose. Money helps, absolutely, but over time, if it doesn't deliver purpose, the money doesn't really matter anymore. This in turn can help reduce burnout and the turnover rates, which is leading to more stable workforce. Moreover, AI can improve patient outcomes by ensuring that administrative processes are handled quickly and accurately. For instance, AI can help identify patients who need follow-up care or having upcoming appointments. This ensures that they receive timely and appropriate care. So a critical point to emphasize is that AI and automation are not here to replace human resources. They're rather to augment them, right? According to a McKinsey report, organizations that implemented AI and automation saw a 20 to 30% increase in productivity. As AI took over routine tasks and allowed human staff to focus on more complex and strategic activities, in healthcare, this means that AI can handle tasks like eligibility checks and prior authorizations, freeing up staff to provide direct patient care and address more complex issues. So let's consider some practical examples on how AI can be applied to improve patient scheduling. Traditionally, scheduling has been a manual process with staff members coordinating appointments based on availability as well as pay. However, this process can be time consuming and prone to errors. By using AI-driven scheduling tools, healthcare providers can optimize appointment slots, reduce wait times, and improve patient satisfaction. So AI can analyze factors through machine learning, such as appointment duration, provider availability, and patient preferences to create a more efficient and patient-friendly scheduling system. So another critical area for automation is patient engagement. So imagine some self-service solutions, such as online scheduling and payment portals. This empowers patients to manage their appointments and financial responsibilities independently and on their own time. This not only improves the patient experience, but also reduces demand on front-end staff. For example, an AI-powered chatbot can assist patients in scheduling appointments, answering common questions, and providing reminders for them, which will reduce the workload on staff and enhancing patient satisfaction. So, how can healthcare providers start implementing AI and automation solutions? So, here are some practical steps to get you started. First, and like anything that you're assessing, it all starts with looking at your current processes. And you want to identify some of the areas that are ripe for automation. I've said this for just about anything. If you're looking at your denials management processes, you're looking at your revenue cycle processes, your front charge capture processes, your documentation processes, certainly is no different for AI. You need to assess your current processes. You want to look for tasks that are repetitive, time consuming, and prone for errors. These are the tasks where automation can have the most significant impact. You want to conduct a thorough analysis of your revenue cycle processes to pinpoint specific pain points and inefficiencies that can be addressed with AI. Next, you want to invest in training and development of your staff. Just like everything else I just mentioned, from documentation to revenue cycle to coding, whatever the case may be, E&M documentation, all of this. You need to train and develop your staff. Make sure you take the time to train. It's very important that this is done. This is a crucial step to ensure that your team is comfortable using the new technologies and understands how to leverage them effectively. A tool is only as effective as its use. And if it's used improperly, then it's not going to be very useful. If it's used appropriately, it can be very powerful. So providing comprehensive training programs and ongoing support can help ease the transition and ensure that the staff are confident in using AI and automation tools. So partnering with the technology providers who can offer tailored solution support can also be very, very beneficial. Now, lastly, and this is also just as important as the others, start small, right? You want to start small by automating specific processes before scaling up. Many times people will just want to jump in feet first or head first and take it all in and start, all these ideas are going through their head, and they want to start implementing all types of processes for automation and AI everywhere. For instance, you might begin with automating insurance verifications or prior authorizations. Once you've seen success in these areas, you can expand automation to other parts of your revenue cycle. So taking a phased approach allows you to manage the implementation process more effectively and minimize disruptions to your operations. For example, a healthcare provider might start by automating the prior authorization process, which involves significant manual effort and can benefit greatly from automation. Once this process is optimized, the provider can move on to automating other areas such as claims management and patient scheduling. One single automation project can bring huge results. For instance, a hospital, which we're going to not name them specifically, but implemented an AI-driven prior authorization solution and saw an 85% reduction in processing time, allowing staff to focus on more critical tasks. Now that correlates with the 60% time that I mentioned earlier. Again, for your prior authorization processes, imagine here's 85% of your time back. What would you do with that? Just imagine how efficient you could be. Similarly, AI can help identify patterns in denials and suggest the most effective follow-up actions. With this automation alone, another healthcare system that implemented an AI-driven AR management solution reported a 30% increase in revenue recovery within the first 6 months. So what would you do with 30% increase in revenue recovery? How efficient would that be? It's just a huge impact on your revenue. So by implementing these practical steps, healthcare providers can start to see the benefits of AI and automation, leading to more efficient operations, reduced costs, and improved patient care. So it's important not to replace human staff, but to augment their capabilities and allow them to focus on more complex and meaningful tasks. Moreover, embracing AI and automation can position healthcare organizations as leaders in innovation, where you can attract top talent and you can enhance your reputation in the industry. As AI technology continues to evolve, the potential applications in healthcare will expand, offering even more opportunities to improve efficiency as well as patient outcomes. Now, I know I've covered a lot here. A lot of ground has been covered today. from understanding the impact of staffing shortages to exploring AI-driven solutions and practical implementation steps. But now I'd like to open up the floor for any questions you might have. This is actually a very good question. Let me see if I can read this correctly. So, okay. Can you provide more details, I believe trying to say, on the initial cost and time investment required for implementing AI and automation solutions in a mid-sized healthcare practice? Are there any specific case studies that highlight the ROI within the first year of implementation? Okay, so that's an excellent question. We want to kind of understand, kind of cost and time investment. And I can say that, well, the cost is going to vary. The initial cost typically includes software licensing, hardware upgrades, and integration services. Additional costs may include staff training, potential temporary staffing to manage the transition period. I can't really give you the exact cost or estimate because I don't want you to hold me to it because there's just so many variables, and those variables certainly are accounted for that. But also another variable is time. It's the people when you think about cost, people think about money, they think about cash, right? So the time required for implementation can vary and can generally range anywhere from 3 to 6 months, really depending upon the project, the scale of the project, what automation is being done. So taking that phased approach that I mentioned earlier can really help manage this time investment. So you can gradually introduce AI and automations and do it in short little spurts can be a real big help. So you asked for a case study. I'm just trying to think of some things that came to mind, but I think that there was a healthcare clinic that adopted, an AI and automation for claims management systems. Let's say their total investment, let's just say, just pick a number, round number, $100,000. Within the first year, the clinic reported 30% increase in revenue recovery. This is that example I mentioned earlier. And there was also a 25% reduction in claims. So the ROI was achieved within 8 months. So imagine in 8 months, you got the money back, right? Or they got the money back. So primarily, really through improved claims processing and accuracy. And this reduced the administrative workload. So I hope that answers that question effectively. We'll see what other questions we have here. So here's one. How would you calculate the financial burden of hiring new patient staff? So yeah, I mean, what's an example of automation enabling patient access teams? So yeah, that's an excellent question as well. So I think you just have to look at the financial burden would be, the time and effort. You may have to go to some recruiting services, some recruiting sites. The expense of getting the word out, that's going to vary as well. Depending upon the position, you have to assess, okay, what is the market bearing right now? Don't just look at what you're paying your staff currently, which may be another issue that you have to give them a raise as well. But what is the market looking for in staff from an expense standpoint? There are certain, you can go to salary.com to kind of look that up as well. But then also the time it takes. I think I mentioned earlier, it's about 42-day process on average to hire anyone these days that's across multiple industries. But you also have to consider the level of expertise you're hiring. That could vary. So if you're hiring someone that's junior with less experience to someone that has a lot of experience, that's going to weigh in that factor as well. So as far as an example of automation enabling patient access teams, it's definitely a way where you can use certain direct API calls, some RPAs, which is, the bots that can actually be repetitive in ways to where it can repeat what a human does. Because we all know RPAs are considered just an electronic human, someone that's going to perform that task that's repetitive. And so you just have a license for each one of those RPAs that can perform those tasks really the same way that humans would perform those tasks. So that just enables and frees up time for the staff where you may not need to hire additional staff. You can keep your existing staff, keep them happy, but automation can help supplement the work they do so they focus, and it really does make them more productive. So that's just one example there. So hope I answered that question as well. There is one more question that we have, and it's what are some common challenges healthcare organizations face getting AI and automation into their existing systems? And how can these challenges be mitigated to ensure a successful implementation? Okay, another two question in one. I love it. So the answer is, basically integrating AI and automation into existing systems can present several challenges. First of all, there's compatibility with those systems. You want to ensure that the new AI and automation tools are compatible with that existing EHR or the software system, whatever software system it is. You also have, you want to conduct a thorough assessment of the current system. Again, like I said earlier, you want to make sure that that's what are the capabilities that exist in that system already, and do they offer any seamless integration? Do they have APIs? Are you able to communicate back and forth between two systems? You want to engage with that vendor and working with your specific systems. Make sure that that customization and integration is also supported. So there's also data security. That's another challenge. You need to maintain compliance with regulations with HIPAA, with handling this sensitive patient data. Again, you want to work with your vendors to make sure that they prioritize data security and have robust encryption and security protocols in place. Most people already have this in place. I would have to say that with the current cyber attacks that have happened recently, that's been stepped up quite a bit. So be prepared for increased security that could actually cause a little more time for implementation. And then training. It goes back to training. Train. You just need to make sure that your staff are comfortable, proficient with these new technologies. Invest in that comprehensive training that's highlighted with those processes that's going to be beneficial for them to take on this AI and automation, so to speak. Provide hands-on training sessions when able, and also have a feedback loop. Get that feedback from them because you may have to make some adjustments along the way. So you also want to mitigate any workflow disruptions. This goes back to making sure that you're taking these AI projects on one step at a time, because you don't want the whole thing to be disrupted. You want to consider, and that should be evaluated in your process, in the evaluation process, where you want to make sure that those disruptions don't affect another area of your revenue cycle. So that's another way you want to kind of, I'm not for silos, but in this instance, siloing this particular project from everything else in your RCM, because if something goes wrong and affects everything, then you'd have a disaster on your end. So you just want to make sure you take those steps, and if you plan accordingly, your disruptions will be minimal. So with that, I think that's it for our questions. I want to thank everyone for joining me today. We do have a treat next week for you, where we're going to do the best of prior authorizations, kind of a sneak announcement for that, since next week we're all celebrating the 4th of July. But to recap, our staffing shortages are significant challenge in healthcare, but AI and automation offer promising solutions to alleviate these issues. So by carefully assessing your processes, investing in training, and starting small, you can successfully integrate these technologies into your operations. So as always, if you have any further questions or need additional resources, please feel free to reach out to us. And if you want to see these in action and how we do these for our clients, you can always request a demo. We'll be happy to speak to you about that and how we can help you. So thank you for joining us today, and we hope you found the session very, very valuable. Have a great day, everyone.
Thanks for joining us. Subscribe to get notified when our next episode is online. For more information for how we can help you increase reimbursements at your company, check out our website at infinix.com. That's INFINX.com.